Bandiera rossa trionferà, di bandiera rosera trionferà.
Competition can also lead to downward pressure on costs, and most of your costs in healthcare are the costs of the people who actually do the caring. So if you have competition in healthcare, equally you can find that the quality of your care is reduced. We also have the threat of privatization, which comes about as a result of competition. We know that more and more contracts up and down England are being given to private companies. In Leicester, there are some contracts that we regard as a problem. I think the Arriva contract for non-emergency patient transport has not been an unqualified success. And similarly, I think the Interserve contract in UHL providing cleaning and catering has also seen some problems. But there's another threat which we face in the NHS, and that is the threat of chronic underfunding. The government has said repeatedly that it is protecting the funding of the NHS. And what it means by that is that the funding of the NHS is just about keeping pace with inflation. But in fact, that is not enough for the NHS. Because the NHS requires an extra 4% a year just to keep pace with rising health service costs, because inflation inside the NHS is actually higher than general inflation. Also because we have a changing structure to our population and we have rising need. So the NHS actually needs 4% additionally each year. And the result of this is that some of our services are not managing to keep up. We see a demoralisation among staff whose pay has been held down year after year, and there are even difficulties in recruitment, if you could believe that. And we also see a growing number of deficits in the NHS across the country. So at the moment there are about 65 NHS trusts across England which have deficits, and here our own hospitals have a deficit of about £40 million. And in fact, our local health community has been described as a failing health economy. And we have the assistance of one of the big four accountancy firms, Ernst & Young, who are helping draw up health service plans. One of the consequences of chronic underfunding is that we are being told we now have to reorganise radically the health service. This is called reconfiguration, the reorganisation of the way in which services are delivered. Some of this is going to involve finding that specialist hospital care is no longer available in Leicester, and that instead we have to travel to Nottingham for some of it. And we can also expect some services that are currently provided in hospitals to be transferred out into community settings. Now, some of this could be good if it is based on sound evidence. And we'll have to wait and see what the proposals are to see if they are evidence-based proposals. But there is an additional danger to transferring services out of hospitals and into the community. Partly, you can break them up and you can contract them out to private providers, but also they are much more difficult to monitor and much more difficult to defend. Somebody said to me last week why do you think you're trying to defend the NHS? He said, don't you realise there isn't an NHS to defend anymore? So much of it has already been contracted out. And I knew what he was getting at. I knew what he was trying to say to me. But for as long as we have a national health service, which is overwhelmingly publicly provided, and a national health service which is free at the point of delivery, then we certainly have something worth defending. And if anything, it is more important, not less important, that we defend the NHS now. Particularly as, because of this deliberate policy of underfunding, more and more people are talking about the need to introduce charges for healthcare, something we have to do everything in our power to prevent from happening. So please join us in defending the National Health Service. There's a public meeting on the 14th of June, a Saturday afternoon at 2 o'clock in the Adult Education Centre. Everybody is welcome.